Hi everyone, I'm Dr. Nina, maternal fetal medicine specialist. In this short video, we'll be discussing about the importance of having a cervical screening and what are its implications related with pregnancy. So, if you are planning pregnancy and if you're due for a cervical screening, then you should not miss it. Please complete a cervical screening. But if you are due for a cervical screening, either by a pap smear or a HPV liquid cytology, and you're already pregnant in your early pregnancy, you can still do your cervical screening up to 12 weeks of gestation. The reason why it is not usually advised beyond 12 weeks of gestation is that it is difficult to interpret the cell changes from the result with related to the pregnancy. And if you are in later part of pregnancy and if you're due for a cervical smear or a cervical screen, then usually it is advised to postpone the screen unless you have any concerns up to 3 months after your delivery. What is cervical screening? It is basically to do a local examination from down below, that is the neck of the womb, which is called as a cervix, and take a few sample of cells from the outer lining of the neck of the womb, which is the cervix, and to study it to see whether there are any abnormal changes of the cells. The abnormal changes of the cells could be because of a type of cervical infection by a virus, which is human papilloma virus. In early stages, it usually resolves spontaneously, but in later stages, it may need treatment in the form of surgery. So, even if the cervical smear is showing any initial changes of the cervical cells in the early part of pregnancy, usually we advise to go ahead with the pregnancy and to follow up after 3 months of your delivery. In case there are any very abnormal changes of the cells in the cervical screen, then we can go ahead at a further evaluation which using a type of study called colposcopy, where with the help of camera we look in detail into the cell type changes of the neck of the womb, which is the cervix. And if it is an early stage, it is advisable or recommended to go ahead with the pregnancy and follow up after delivery. If you are up to date with your cervical screen, then usually you are safe without having a cervical screen throughout your pregnancy, and you can follow it after delivery. But in between, if you have any concerns like abnormal increased discharge down below or any pain or bleeding from the cervix, in these cases please seek doctor's opinion and get a cervical screen done. Why is it required? Because if we find out these abnormal changes of the cells from the cervix, we will be able to treat it promptly and prevent the progression to a cervical cancer. And thus, it helps to improve the outcome and to have a better future for you as well as for your baby. Thank you.